Welcome everyone. I'm Dr. Pranav and here is our host.
I am Dr. Ashok Yadav. I am Assistant Professor J.D. Goenka University, and I welcome all of you on the behalf of J.D. Goenka University. And today we are here to know about the MPH, what are the scope, what are the career options, and what is actually public health. So I welcome Dr. Pranava Prakash, HOD,
Thank you, sir.
Public Health Department, J.D. Goenka University. Sir, tell our students about what is MPH and how they can participate in public health.
Great. First of all, I welcome all the prospective public health professionals. It's really great to hear that a lot of young students now they are interested in public health and they want to create a great environment for healthcare delivery. Most of students you have at graduation level somewhere or other at one position or other you have studied about what is the scope of community health. Still to revise the concept and to talk you from the perspective of ground reality, I have been national coordinator for anemia and malaria elimination program. So my experience is that in present times public health is most critical healthcare delivery domain. Why I say so? Because now we have reached a population of 140 crore, and if we talk about the coverage in terms of the ratio of doctors to patient, we are still among the lowest. So that way, if we want to deliver healthcare to all the Indian citizens, we need to work in the domain of public health, which has been summarized. I always keep repeating at all places in front of policymakers, just three aspects, and it's complete public health: prevention, protection, and promotion. If imagine, like, if you talk about United States, every month, mark my word, every month the expenditure on healthcare is in Indian rupees 70,000 rupees. So we cannot imagine such kind of expenditure in India. So starting tertiary centers, big centers, it's out of question. We cannot really have in every district AIMS like center, Apollo and Fortis like center. So somewhere down the line, we have to work to prevent diseases, to prevent cardiac conditions right at the beginning, to prevent infectious conditions right at the beginning. So this is the one aspect that is making public health so popular to all the policymakers. Past 8 to 9 years, more than 1 lakh health and wellness center has been created all across India. And those health and wellness centers, they are being manned by the professionals coming from public health. Earlier, it was notion that only MBBS students will be getting into public health. Then there was not enough supply. How come we can have lakhs of public health professionals if just MBBS are coming? Then BDS, then BAMS, BHMS, all the students came, and it is still a field where we are lacking trained manpower. It's one of the rarest domain where trained manpower is still lacking. If you talk about the data published by government, we have a deficiency of more than million public health professional. Yes, more than million public health professional. So that way it is the domain where coming 2 to 3 decade there is only growth, because from young population, if you have studied the demographics, you know we are right now one of the youngest nation across the globe. Our average age is around 45 to 35 years between the age. Most of our population, that is more than 40% population, it's still age less than 20 years. So that way, when the population starts aging, imagine when the population starts weighting higher on the side of 40 and above, then the role of public health is only going to get enhanced. So to develop healthcare system across the nation and to take care of older population, both the end now public health scope is only going to increase. Such is the wide scope of public health. And the people who are trained in India, now they are rated very high. Their experience is valued very high even in international position. Global South, that is Africa. Now I tell you, all the administrative professionals in WHO in Africa, they are coming from India, because there is a lot of similarity between the condition of India and Africa in terms of infectious condition like malaria, like tuberculosis, like HIV. So the people who are trained in Indian environment, they are getting great scope abroad.
Very well, sir. So, as you told us that after not only after MBBS, other streams can also join MPH program. So, is there any scope for paramedical after doing paramedical courses? Can student join MPH or a doctorate degree is required for MPH?
As we discussed public health, to start first, a very important and critical concept is that public health is a multidisciplinary career where we need students even from BCom background, finance background. So all the paramedical students, they are actually working in even in hospital in health and allied sciences. Someone is working in radiology department, someone is working in lab technology department, optometrics department, and nutrition department, physiotherapy department. So now, by the virtue of their work in hospital, they are already very well versed in the whole healthcare delivery system. So once they come into public health, to a large extent, they understand the system. So they feel that public health for them is a little easier. So all the students who have background in medical and allied sciences from clinical department like BDSS, MBS, MBBS, BAMS and BHMS, Bachelor of Unani and Bachelor of even Yoga, otherwise paramedical students, everyone is welcome over here and they're doing really great. Students even from nursing are doing really great because of their hard work and commitment. And to all my budding public health professionals, I would say anyone can become public health, but not without commitment and sincerity. It's not just a gold mine where you are recovering gold. Here is a career where you have to be deeply committed to community overall healthcare delivery, and we have to play a very great role. Imagine the role we played in the times of corona. The public health people, in terms of diagnosis, prevention, planning, and delivery, we played a critical role and everyone appreciated. And times are there where with the effect of public health, we are going to eliminate tuberculosis by 2030. We are going to eliminate malaria by 2030. We are working on anemia mukt Bharat, that is anemia free India. So imagine such kind of big diseases we are going to curb. Government policy is there, and if you look at the website of NVBDCP, we are on the right track. Government is saying that we are on the way to eliminate malaria, a disease which has caused most death in human history, and now we are in the phase of eliminating it. And imagine a country of our size. So the scope is immense for passionate and committed people to come to public health and to deliver great health.
So, students, it's an open meeting. You can also ask any question if you have. I am asking on behalf of you. So, sir, just tell us about how to choose a good college for doing MPH and how the GD Goenka University is a good option than other colleges.
Great. Uh, there are two ways how we are looking at selection of colleges. As we discussed, public health is about delivering prevention, protection, and promotion at the doorstep of community. For that, you need to have great commitment to public goal, and you have to be sincere and passionate about community work and a healthcare delivery point of thinking. This requires three critical skills to become a proficient public health professional. And these skills are, which I learned very hard after doing MBBS. The first skill that you need to acquire is addressing community. Like if you are working in hospital, you are trained in one-to-one communication. Single patient comes to you and we are having one-to-one conversation in a very intimate, in a very trustworthy environment, and we take out the history of patient, do the diagnosis, go for lab diagnosis, treatment, imaging, and then you treat the patient. Once you get into public health, the challenge is all at once you are addressing people. First time when I was in public health, so my work was associated in improving the condition of menstrual hygiene condition of adolescent girls in UP and Eastern Bihar. Now for me, talking on such sensitive issue, being male myself and talking to young girls, so I had lot of hesitation. The girls were having hesitation. I had to overcome. So it required lot of practice, lot of commitment and hand holding from my seniors. But gradually we overcame and we built a certain environment of trust. So number one skill that is required is communication. At GD Goenka University, we have a extensive communication training where in our projects which we are doing in field, like the projects we are doing for anemia mukt Haryana and malaria elimination program. So we are going to villages where in the field you are doing communication, you are doing public address. Then we have a communication lab right here where we are doing this one-to-one video communication with you. We are doing this from communication lab only. So we have a well-equipped lab. You can see all the things over here once you come. So you also learn video communication, and most of students, we are encouraging them to get into YouTube, Facebook, Instagram, and getting to communicate at all the places. Then we also train students on the different softwares, the media and graphic softwares, to connect, to design the different promotion and communication strategy. So that is again one thing we are training our students very hard. So first thing, when I came, I thought communication is one thing where student needs to be trained really hard. The second thing is, which is required very much from public health leaders, that is survey research, research planning. So again, students right from the first semester get extensive exposure how to design the survey questionnaire, how to administer the questionnaire door to door. Like we have collaboration with Medanta, Med City and Anemia Mukt Haryana. So there we have two villages where we are conducting the pilot program, and the two villages we are covering more than 8,000 different individuals from 3,000 different homes. So our students are going to homes, collecting data, facing all the challenges that you are going to face when you are in your community health officer job in government or in NGO. So complete technical process of epidemiology is there. And thirdly, the training part also involves research data analysis, because as a public health professional, the kind of large data you get, you need only to do analysis on software. So extensive exposure to analysis also is there, because we already have our own data sets to examine, to analyze. So with these three things, I'm confident we are no less than best of the best institutions. Only we are young. That's why we are so focused, so committed, a little lesser known as compared to different AIMSs. But I promise you, within 2 to 3 years, we will be at par in terms of everything, straightway to AIMSs and slightly better than IHMR and TEST.
So, sir, I have two, three more questions. After that, we'll open the meeting for student to ask any question.
Sure, sure.
So, sir, tell us about the course curriculum which student are going to study in next 2 year, and how it is different than other universities.
Great. So the course is of 4 semester, and as we emphasize times and again, here especially we have 8 months of extensive training, which is 2 months at the end of second semester, where students go for field training live and under the guidance of teacher, where teachers are guiding them on the day-to-day basis, how to do literature review, how to go for designing the survey, how to implement the survey, and finally how to do analysis. Post that, we create thesis and a summary of research paper as well, which is published in best of the research journals. Then 6 months at the end of in fourth semester, students are getting internship and field training, where a large thesis is created and student work in absolute professional environment just like a professional, so that most of the students, they are getting a placement offer right at the time in their fourth semester. Talking about our syllabus, so first semester we are talking about the basic sciences, one on the implementation side and another side on public health. So what is public health, how do we deliver public health, and then what are the basics of public health delivery in terms of management. So we have some courses of management also, economics courses, operation management courses, and thereafter second semester students are doing regular field surveys, and side by side they are doing courses on analysis of data, advanced research analysis, and then they go for internship. At the end of internship, they do a viva and they get into third semester they get elective epidemiology, maternal health, child health, and then based on their selected electives, they are specializing either in epidemiology or maternal health or child health or infectious conditions. Once they are well versed, as we discussed, fourth semester is extensive field training in company setting, in organization setting. Mostly students are getting placement offers there, and they are open in the field, working hard to make India a healthy nation.
Very nice, sir. So, in my understanding, it is a good combination of field training as well as academic. So, my next question is, sir, what is the which is a common question from all the students? What about the pay scale and scope after doing MPH?
Yes, as we understand, all the young people, they are looking to make a great career uh, in their future. So public health offers a great future. As I talk to all the students, career is made by two things: present salary and growth. So salary offered right after course also is great, and growth, as we discussed, coming 2 to 3 decade is actually about the decade of public health. I'm not saying hospitals are going to close up, but the kind of growth that public health is going to see is tremendous, much more than hospital. Talking about the placements, so it is based upon the kind of experience you have, because our public health batch is mixed. There are some students who have got experience of 5 6 years. We have sometimes had students from army background, where students are colonel and brigadier, they have got experience of more than 2 decades also. So that way the students who are very experienced, their salary definitely gets into higher package. Students who are absolute fresher, their salary will be a little less than students who have got more than a decade experience. But generally I would say a student can expect a good salary. If he has got experience of 3 to 5 years, he can expect a salary between 9 to 12 lakhs in Indian condition, and WHO positions and UNICEF positions between 18 to 25 lakhs. For an absolute fresher, the salary still will be no less than 5 to 6 lakhs.
Very nice, sir. So, one more question, sir, from one student. Uh, he's asking about what kind of help university do in placement.
Great, sir. So we have got an extensive training and placement department, that is Corporate Resource Center CRC, which is run by a big team of 12 people, and all the big companies and NGOs and CSR foundations we are in touch with. All the job options and opportunity whenever they come, our students are well versed. We provide for group discussion training, mock interview, and rigorous training for mock interview sessions all through the sessions, right from first semester till fourth semester. Thereafter, as and when the opportunities are coming, because in public health, opportunities keep coming continuously. So many times, right from third semester, students are going to companies, they are getting placed. So overall, the CRC department will be giving lots and lot of opportunity. So more than one opportunity almost every student is getting. And being in NCR, that is Delhi National Capital Region, all the big institutions working in public health, you name it, and it is headquartered in India. And all the Indian institutions are headquartered in Delhi NCR. So we are absolutely connected with them, be it National Vector-Borne Disease Control Program, UNICEF, WHO, Ford Foundation, or the Union for Tuberculosis, Global Fund for HIV, Malaria, and tuberculosis. So all the big organization, we are continuously doing projects, doing research. So we are connected.
So thank you, sir. So one more question, sir, from a girl student. She is asking, is it only a field job, or she will get any office to do work after completing the
Uh,
course?
I understand the situation. Many parents also who accompany the students coming from background like BDS, BAMS, and they are saying that it has been long course, and now parents have got a concern that their girl child get into family mood and marriage. So there are lot of opportunity even for office jobs, like research job is there in different research organization like Incline, where our students were placed, Medanta Institute, where our students are doing great research work and analysis side. Then grant writing is another field where students are working. Some of our students were placed in Trios, where they are doing grant writing. And then you can work in policy centers. So CPR is another agency, where a Center for Policy Research, where our students are working. So policy research, grant writing, research and analysis, these are some of the field where you can work from office, where the movement is very limited. And yes, as you discussed, if you want to move across India and across the world, public health is your go-to field.
Very well, sir. So thank you so much, sir, for elaborating on MPH. And I would like to ask our students, if they have any question, please raise your hand, or you can ask the question from Daksha.
Any question, every question, everything is welcome. You can unmute yourself and ask question. And I would like, if you before asking question, you can switch on your camera as well, so that we be face to face, if possible.
Shivam, do you have any question?
Hello, sir. Yeah, no, sir. I don't have any questions. I've already got my things cleared.
Okay.
Thank you.
Great.
Thank you, sir.
Thank you.
Any other student? Simran, Kulvinder?
No, sir.
Okay, so if you don't have any question, you can always contact me on my phone number, me or Dr. Ashok. The number will be available. Is already shared on YouTube and Instagram. You can again note it down. It is 991032. I'm repeating again, 991032 2892. Should I repeat again? 9910322892. So here you can ask any question regarding admission process, career in public health, any challenge you are facing being here in Delhi. Any question and every question is welcome.
And you can also follow us on YouTube, Instagram, and other social media channels. So,
Yes.
sir, please elaborate on the link.
Yeah, the link I would share on the WhatsApp group. We have our YouTube channel as well by the name of Department of Public Health, GD Goenka University, and we have got an Instagram page also where all the updates of our programs and different activity that we conduct is there. Stay connected. Thanks a lot. So if you don't have any question, should we disconnect? Okay. Thanks a lot.